what neurodivergent culture looks like when we're not masking. And it's also a place where coaches, therapists can offer workshops on a myriad of subjects. I also have a background in facilitating and teaching restorative justice practices, and I've led queer theory and diversity discussion groups for a very humbling 20 years now. And I have raging ADHD, a whole lot. So I will do my best to keep this coherent and not overwhelming. So when we talk about ADHD, or when I talk about ADHD, this is sort of the base that I'm talking about. I tend to use Russell Barkley as my baseline. Russell Barkley is one of the most preeminent ADHD experts. He has an incredible track record of research and peer review. He has technically retired, but then apparently he's started his own YouTube channel, and he does wonderful summaries of all of the recent studies that have come out on ADHD. He gets into the neurobiology. He gets into the physiology. He gets into the neurotransmitters. He gets into best practices. He's a tremendous resource. One of his books just this last year came out with a new edition, taking charge of adult ADHD, which is a really fantastic resource. So when I'm talking about ADHD, I'm talking about a polygenetic condition with a very high level of heritability. We've linked it to genes, very specific genes. We've tracked it throughout history. We know that it travels in families. It is also caused by some de novo gene interactions, environmental interactions, epigenetics that accounts for about 10% of ADHD. There are a lot of symptom overlaps where it can look like other things. But key factors that we're looking for is hyperactivity, which overall in adults turns into inattention as that hyperactivity becomes internalized. The symptoms change, but what we know now in the last few years is that ADHD does not, by and large, go away in childhood. We're looking at a consistently inconsistent focus and energy throughout the lifespan. So inconsistent focus, energy, things like that can absolutely happen with trauma, with anxiety, with depression, but usually not throughout a lifespan, and usually not that consistently inconsistent. We're also looking at difficulty with executive functions, to a degree of significant impairment or harm across many areas of life. There are about 30 different models of executive function. There's the Thomas Brown model, there's the Russell Barkley model, there's the Holloway model. How we divide these various executive functions is less important to seeing how they are impacting individuals with ADHD and to what extent folks are impaired, meaningfully impaired throughout their lives. We're also looking at an inability to control self-directed action. And this is a really tricky one. This is a huge reason why, just sort of giving advice to ADHDers, being like, well, just use a planner, isn't really helpful and can actually be fairly traumatizing. It's sort of like yelling at somebody that doesn't know how to swim, just paddle. We would love to. We would absolutely love to. This problem is deeper than that. It's also a difficulty with emotional regulation. And this is an aspect that is not in the DSM yet. There is a lot of advocacy to have this included in the DSM. Last year, Russell Barkley did a lecture on the emotional regulation aspect, and his theory is that the emotional regulation aspect is as important a part of ADHD as focus and attention. That rather than being motivated by importance and consequence, we really have emotional-based nervous systems. The other aspect of ADHD that we're looking at is severity. It's very common to hear that everybody has a little ADHD. And I think one of the best memes I've seen lately was one that responded to this with, well, yes, everybody has to pee too, but if you're having to pee every 10 minutes, you should probably see a doctor. And when you look at how people respond to the BAARS-4, which is Russell Barkley's questionnaire evaluation for ADHD, the degree to the frequency to which things like losing your keys or not being able to clean or not being able to start tasks or dealing with rejection sensitive dysphoria, trouble planning, impact folks with ADHD is increased by an order of magnitude compared to people without ADHD. So yes, everybody loses their keys from time to time. But if it's happening every day and making you late to work, that is a different categorical thing that we're dealing with. And that brings me to the other important thing that I want to mention, which is impact. ADHD has a reputation for being just sort of quirky, being eccentric, folks being too much or really intense or sort of off the wall or creative. And that's all well and good. But the impact of this is that ADHD is the most common psychiatric disorder in children. Approximately 11% of children between 4 and 17 having an ADHD diagnosis. Adult ADHD is still relatively understudied. My personal theory on why this is because initially we were primarily only looking at cisgender white male children. And as they grew up, they got girlfriends and secretaries and wives who then handled the executive function. The symptoms went away because they were supported environmentally, but the ADHD remained. And so now we're sort of realizing that other people have ADHD, that ADHD doesn't get better in adulthood, just the symptoms change. And we're still not looking at what those symptoms look like in a lot of populations. And so in addition to the pervasiveness of ADHD, the impact is also very intense. Children are 2 times as likely to die in childhood, 5 times as likely to die by midlife. There is approximately a 13-year life expectancy reduction for untreated ADHD. And it causes, it's sort of from what we can tell, a bit of a linchpin issue. It commonly co-occurs with accidental injuries, with suicide, obesity, type 2 diabetes, smoking, excessive alcohol use, impaired sleep is a huge one, poor nutrition, and chronic pain. And all of this is in contrast that ADHD is one of the most treatable mental health disorders in psychiatry. So this is a place where we really can make a huge difference. The next slide, I just want to brace folks. We're not going to go through this whole thing. This is a resource. So APSARD has a wonderful timeline of the history of ADHD, the modern history of ADHD. I think that this is useful to consider, especially currently, as so many more people are getting diagnosed or self-diagnosing, and it feels like there's just this like influx that raises some eyebrows, right? Which, you know, we do want to make sure that we are actually treating ADHD, or ADHD and autism, which we did not realize could co-occur up until recently. But medical professionals, going back to Hippocrates, have been describing attention disorders, have been describing restlessness of the mind, have been describing just these very eccentric, just sort of slightly different behaviors within a medical model since the ancient Greeks. And that cluster of symptoms shows up consistently throughout cultures. One of my favorite rabbit holes is to look at where neurodivergence shows up in mythology, in fiction, in stories, things like that, just to sort of see what that role has been throughout the ages and different cultures. And that is also a perspective that I encourage folks to consider, because there is this debate of, is it a superpower? Is it overly pathologized? Is it a disease? Is it a disablement? There are a lot of people who have done very well who have ADHD. And I think it's very interesting to look at when somebody has enough privilege to have support, to have adequate support, what symptoms lessen. I think that this gets into sort of a question of looking at the extended phenotype, looking at the environmental model, rather than looking at an individual isolated from their environment and community. And in addition to that, looking at which of the aspects of ADHD are actually causing harm to the individual, not necessarily causing discomfort to those around them, their partner, their boss, folks like that, unless that is impacting them as well, because difference is not necessarily a problem. Harm is a problem. And we can look at that through a lens of, what is correlative and what is causal, especially when trying to distinguish between, ADHD and, trauma, for example. So now we're going to pivot to the ADHD coaching aspect. I'm going to bring out a new PowerPoint slide deck, because dopamine. So one of my best favorite definitions of ADHD coaching comes from Amin and Saviet, which is ADHD coaching is a goal-oriented, supportive, client-led collaboration. It utilizes self-awareness, discovery, and psychoeducation to assist the client in developing custom external systems, as well as internal self-regulating strategies to implement at the point of performance. And that is key to improve and manage the ADHD symptoms and related conditions. Sorry. Here we go. Oops, sorry, slide issues. Okay, apologies. So it's very common for folks to think that it's coaching versus therapy. My perspective is that these are two areas of mental health support that are incredibly valuable as complementary strategies. Therapy can provide a place to explore identity. That includes when somebody has just been diagnosed, integrating that aspect into their identity, which is a whole roller coaster. Healing traumas, whether those are related to ADHD. I frequently see folks describe symptoms that seem very similar to CPTSD, just from the experience of growing up with ADHD and not knowing it, a sort of neurodysmorphia, of expecting themselves to be neurotypical and wondering, why is this like like, why does it seem so easy for everybody else? I must be broken. And that, seems to cause a deep fracture in self-trust. And that is something that, therapists really are such an incredible resource to help folks navigate and understand and heal. Part of that is building self-awareness and understanding. There are some obstacles, though, that for ADHDers in getting all of the support they need simply through therapy. One of those is the power differential. Part of the reason why therapy can be such a safe space is because of the extensive training that therapists go through to be able to maintain a space that is that safe. And part of that is a power differential. Therapists, psychologists, counselors, psychiatrists can make decisions that impact a patient's life. And because of that, there is an inherent risk. There can be more of a motivation to mask or perform that can be really difficult for ADHDers. There can be sort of a very open lack of structure. ADHDers can be very prone to ruminating rather than reflecting. Therapy also has, for lack of knowing how to better state it, a very sort of neurotypical bias for understandable reasons. We're looking at pathologies, we're looking at things with harm. We're still sort of figuring out what neurodivergent cultural competence looks like, especially as we're realizing that many neurodivergents, especially ADHDers, have a different sort of emotional system. So things like mindfulness are very different for ADHDers. How we relate to motivation is very different for ADHDers. Even rumination, going back to that previous point, rumination gives us dopamine. It may not just be a trauma response. It may be the brain just trying to feed itself using the only available resource at that time. It can be sort of like, using the in case of emergency break glass for everything. It's not a great strategy, but if it's all we have, we'll use it. Coaching really complements therapy in that it's sort of a collaborative workshop where concepts and things, insights from therapy can be implemented and experimented with in a sort of a horizontally neutral power dynamic, sort of having somebody to figure it out with. That being said, one of the biggest obstacles in ADHD coaching is trauma and anxiety. That is something that, as coaches, we are not really trained on how to deal with. I have, training from my previous work in that, and also it's not the same as the training that therapists get on managing trauma. And a lot of times we just get stuck there. So coaches need to know at what point we need to refer to therapists or bring a therapist in, or help our clients find a therapist, because unfortunately it requires a whole lot of executive function to find a therapist. We also, are not particularly trained in pharmacology and diagnosis. Many of the clients that I see do not understand what their medications are doing, do not understand why, their doctors have chosen particular medications, how they interact, how to assess if the medications are optimized, any of those things, as well as dealing with that identity integration with diagnosis. There's a real need for self-awareness. In coaching, we are building tools, we are implementing strategies, but the raw material that we're working from is that self-awareness, that noticing what has happened in the past, what have we tried in the past, what has worked, what hasn't worked, and that requires a lot of sort of just legwork that happens in therapy, that digging, that exploring, that noticing, which is it's a different manner of approach than the practicality of coaching. It's also a space where there can be education and collaboration. But I say that from a very from an educational perspective that comes from universal design and the Freirean pedagogy of the oppressed. So where the student and the teacher are collaborating to learn, because of course if there are the patterns, the cluster of symptoms, but ADHD is not two-dimensional. If you've met a person with ADHD, you've met one person with ADHD. There's a lot of other factors in the mix, and it doesn't do much of a service to teach somebody with ADHD about the ADHD on paper without getting into how it applies to them, without mapping how it affects them as a whole person. And so there is that exploratory aspect as well, that therapists have a bit of a better perspective on all of those working pieces. And a metaphor that I find is really helpful in terms of how coaches and therapists can collaborate comes from this Buddhist parable about a river. And so a person is walking past a river, and they see children in the river, and they pull the children out, of course. And then because there's a waterfall at the bottom, and the children could be really harmed, they could drown, they could get hurt. And so the person pulls the children out of the river, and then they see more children coming down the river, and they look up the river and they see somebody, for whatever horrible, depraved reason, throwing children into the river. And it gets into this sort of conundrum of, well, do you pull the children out of the river, or do you run up to the start of the river and stop the person who's throwing them in? And it gets into this sort of philosophical, trolleyology paradox of, do you sacrifice the now for the past, or do you neglect the past for the now? Many clients that I work with struggle with that exact conflict. It is really hard to create the space, create the capacity to go back into childhood, into our past experiences, to heal old wounds, to integrate as a person when your daily life is on fire. There's that need for triage. And at the same time, if we're running around just doing triage in our daily lives, those strategies are just going to be band-aids if we don't have the capacity to go back and understand the roots of why this keeps happening and how we can change and adapt to prevent it from happening in the future. And so when coaching and therapy can collaborate, there's an opportunity to have space for the deep insights available and the healing that's available in therapy, and the practicality of coaching to create proof that it can work, proof that it can make things better, so that clients aren't just relying on this very exhausted sense of hope or faith, but actually seeing meaningful change, even if it's a tiny step at a time. That creates a bit of self-trust, that creates a bit of reliability. And if you're still wondering, but what do coaches do? The first thing that a lot of folks talk about is SMART goals and accountability. That is definitely a part of it. There is this book is a pretty decent resource source. It's published by the American Psychological Association. It is ADHD Coaching, a guide for mental health professionals. And it's a great guide on SMART goals. It's a great guide on sort of working with students. I will say that in my opinion, it is an incomplete resource. Nowhere in here does it mention emotional regulation. And so right there's going to be motivational problems. You might be, have a whole system for tracking goals and accountability. But if we're not talking about motivation and how the individual client relates to starting things, either the goals aren't going to happen, or the completion of goals is going to be a performative act that is not something that the client can continue to do for themselves. There's accountability as enablement, and there's teaching a client how to create these systems for themselves. So ADHDers, we're very motivated by other people. We can, clean things for other people. We can't clean things for ourselves. Depersonalization is an incredible tool. But if I can only accomplish a goal if somebody is, holding that bar for me that I have to jump over, either I'm only going to get things done when I'm in systems that provide that, or I need to learn how to ask people to hold that bar for me. And those are two very different skills. There's also a lot of cognitive reframing with an ADHD lens and strength-based perspective. This comes into play around perfectionism, around guilt, shame, procrastination, self-awareness, feeling like we just have to push through things and just keep trying harder and harder. Identifying needs also comes into play in a big way, around how we should be able to do things versus what actually works. Exploring unique functions. This gets into motivation. There's the classic ADHD motivators of interest, novelty, urgency, connection to others, challenge or spite, which is one of my favorites, passion and purpose. There's a lot of experimentation, implementation, reassessment, tracking executive functions across situational variability. Me going to the grocery store, I might get completely overwhelmed by too many choices. But if a friend calls me and says, I'm having an emergency, can you grab these 13 things at the grocery store and get to my house in an impossibly short amount of time, I am on it and I have it. I don't even need a list. So looking at what works in different arenas and bridging from that. Distinguishing emotional regulation and emotional motivation. Sometimes we're having feelings because we're just in our feels. Sometimes we're having feelings because that's how our body is trying to get us to do something. Distinguishing between, differences and disablement. That comes up a lot in relationships. Improving utilization of support. This can come around, creating dopamine menus, how to ask for support, especially if folks are, in like rejection sensitive dysphoria, coming up with plans ahead of time. Exploring and advocating for accommodations, dopamine menus, personal user guide. I have a model for that I anthropomorphize into a pug, because we're more likely to do things for the idea of a pug than for ourselves. Exploring stims, coming up with meltdown kits. ADHD coaching often supports folks with career changes, getting jobs, academic support, home management, self-care, interpersonal and communication skills, task initiation, perfectionism, procrastination, and always, always, always motivation. The work that I have done with clients has been some of the most meaningful work that I have ever done in my life. It is an incredible and magical experience to get to work with somebody who, by and large, are some of the most compassionate, brilliant, creative, resilient people I have ever met in my life, and are just so desperate to figure out something that's going to work. and having a place with somebody that they feel safe with and can relate to problem solve, to figure it out, to parse it through where they're, not just, jumping through a hoop, but figuring out something that's going to be reliable, a strategy that, rather than finding the perfect planner, or the perfect morning routine, understanding their needs so that when that system breaks down, because all systems break down, nobody goes to the gym every single day for their entire lives. Things happen. There are weather events, there are pandemics, there's traffic, right? Routines break down. Creating strategies based on self-awareness and an understanding of needs so that when those systems break down, you know that you didn't fail the system. The system failed, and there's an ability to recalibrate and redesign that system that creates a sense of safety and flexibility and strength and possibility that is very powerful and very meaningful to a lot of people. And often that right there distinguishes between strategies that we're just performing because it's what we think we're supposed to do, and actually getting to the root causes of how do we actually manage ourselves? How do we run the system? On the left is one of my favorite memes ever. For those who can't see the slides, it is a older person vacuuming her front yard, and it says, when a neurotypical gives you instructions that you don't understand, but you try to do the thing anyways. I can't tell you how much of my life I went through doing this. I'm like, I think this is how it's supposed to, very monkey see monkey. I think they're doing it this way. I don't understand. Just gonna go along. I was probably in my early 30s before I realized I did not understand the concept of a to-do list. My to-do lists were the length of a CVS receipt. They were just extended into infinity. I thought they were just supposed to be the list of all the things that you're supposed to do. And it just kept weighing me down. It was just creating more and more anxiety. It's like an anchor around my neck. But I also knew it was supposed to be supportive, and it wasn't. And only through starting to work on my ADHD, through coaching with a therapist, that I realized that I was using a to-do list as though I were treading water, overwhelmed, drowning, right? And the to-do list was supposed to be a boat. It was supposed to be something that supported me and made it easier and took the load off of my working memory, right? But I was treading water and holding the boat over my head and just putting more rocks in it. And so that system was not working for me, but I was doing the thing that I thought I was using it how I thought I was supposed to use it. I frequently find with ADHDers, we do really well with very complicated, challenging things, and we really struggle with the things that we think are supposed to be simple. We're kind of offended that they're not simple. We don't understand why. And so there can be some sort of, philosophizing, understanding what is the purpose of this? What do we want it to do? And often that also plays into our relationship with ourselves. I could not pick the perfect heading for this picture on the right. It is a picture of two people trying to push a very stubborn donkey. So that the options for a title are Maybe If I Just Try Harder, the cerebellum, prefrontal cortex, and cerebrum, an ADHD family portrait, or Why Pavlov Used Dogs. If you've ever had the very humbling experience of trying to ride a very stubborn horse that has decided that we are not going out for a walk, we are going to eat the grass over there, and you've tried to pull the horse, you've maybe tried swearing at the horse, and the horse nose is bigger. That is a lot of what it's like trying to get yourself to do something with ADHD. You might be screaming at yourself internally, and it's just not going to work. In coaching, what we do is we try to figure out how to not manipulate the horse, but how to work with the horse, which is, of course, our body, our nervous system, the way that our brains function, our cognition. Does the donkey need an apple? Does it need some sugar? Does it need to trust us more? It's pushing clearly doesn't work. If something is hard, it's probably because it's actually hard and there's probably a better way. So some of the tools that I use in coaching, just for some quick insight as we wrap up here, Michon's model of driving, which can look at tools like to-do lists, schedules, meal planning, social interactions, career development goals, and really break it down. What is the operational level? What is the control level? What is the steering wheel? What is the gas, right? How do we actually maneuver this thing? How do we use those tools? And then the strategic level. How is it going to interact with us? How are we going to remember it, that it exists? What are we going to do if we forget about it? What are we going to do if it breaks down? And actually working through how we use the tools. Another model I use is Prochka's and DiClemente's trans-theoretical model of change. This is a sort of an upward spiral as viewed from the top. And what this does is it reframes progress away from that all or nothing, and also away from that linear progression of perpetually better. It's much more of a model akin to the scientific method. There's contemplation, action, experimentation, relapse. We learn from those mistakes and we keep getting better. And this helps, undermine that cognitive bias of only noticing the bad things and the failures and only listing our successes as the lack of a failure, but actually using that material to build from. A model that I'm also currently working on developing is expanding the life wheel for tracking executive function through situational variability. So this is the classic life wheel. You might label them with areas of life. You might label them with various executive functions. These are just a few lists. And then ask a client to, mark on a level of, rating from, 1 to 10, how they feel like they're doing in that area. What that doesn't account for is the situational variability. As I mentioned in the example previously, my executive function in one area of life, in one circumstance, might be vastly different than it is in another place. So if we use the executive function as a lens, we can start to spot patterns. And we can start to identify conditions in which those executive functions are supported. And we can create those environmental factors to support those needs in other situations. So looking at, how do I focus when it comes to my health? How do I focus when it comes to relationships and my community interactions? How do I focus at work? I put health in there twice. What is focus like for me when I'm playing? I'm going to get different answers there, and it's going to create multiple points of data that can be expanded and used. So one area that I want to offer for how to find the right coach for clients, looking at training. Is this somebody that has ADHD, is familiar with ADHD, has people in their lives who have ADHD? I would also include autism there, because there's a huge amount of the population that are diagnosed with both, or undiagnosed and have both, either one. Is this somebody that I don't want to be gatekeepy here, but is this just somebody who their personal ADHD is not particularly impairing for them, and they're doing it, well, I did it, so you can too, type thing, or are they actually trained? So there's the Professional Association of ADHD Coaching, there's ICF, there's NBHWC. those organizations are still the gold standard as far as coaching skills, even if they don't provide specific ADHD coach training. That ADHD specific training, I think, is very, very important, but also the ICF and NBHWC trainings are very important in terms of like ethics, scope of practice, technique, care and competency. ADHD coaches, ACO has a list of certified coach training programs. I think it's also really important to help clients figure out what they're looking for in a coach, because the number one metric for a client's success in coaching is their connection with the coach. So understanding, what do they want to work on? And that's a very hard question for ADHDers. What types of support actually work for them and what doesn't? How do they work best? Are they somebody that wants a lot of homework? Do they want, resources? Do they want papers to fill out? Or is that going to, fall into that, basket for ADHDers of, well, I was going to do the thing, but you told me to do the thing, so now I'm not going to do the thing. Is it affordable? Is this coaching program being sold with a lot of, financial pressure? Because that's not going to help somebody function. Can they test drive some questions and experience the coaching? And of course, the almighty vibe check. There's also, I think that there's an opportunity for coaches to support therapists. This is not critique. This is not meant as critique. I hear a lot of feedback from clients who are really struggling in therapy. I myself was in therapy for probably the better part of a decade before getting diagnosed with ADHD, and was diagnosed, not by my therapist, but by an independent clinician, through my medical provider. Not even going in with that concern. And I think a lot of that is just sort of a cultural awareness, maybe, about how ADHDers function, rather than how ADHD itself shows up. I frequently, hear about discomfort by being sort of like stared at. This can create a sense of like needing approval, or of course the eye contact issue, feeling judged or like a zoo animal. ADHDers really like to engage by relating, by sharing common experiences, and that can come up against, a lot of therapist training saying to stay reserved, don't engage. That can sort of a difficult thing that I suppose every practitioner is going to have to navigate their own comfort with. Big open-ended questions like, how am I doing, are really difficult for ADHDers. And this isn't just cultural. This is, we've actually tracked this to memory recall issues. There are a number of studies showing that overly broad questions can send ADHDers into a panic. We see this in kids. You ask, how was your day? And they're like, I don't know. It was fine. But if you ask, what was something funny that happened? What was the most interesting part of your day? That's more accessible. We need a bit more context to grab onto. Otherwise, there's just too many possibilities and we're not sure what you want from the question. And this can just send an ADHD straight into masking or shut down or RSD. Feeling like they're backseat driving therapy, not really knowing what the purpose of therapy is. This is something I would encourage folks to like check in with clients regularly. What are we here for? Many clients that I've worked with, neuroqueer community, that I've talked to, interviewed, are just not quite sure what we're doing. Healing, feeling better. You press for more than that and it gets pretty murky. Being ashamed of how bad things are and not feeling comfortable, getting into some of the shame-based stuff, struggling to shower, struggling to feed ourselves. It's really hard, dealing with all these executive function things that don't impact our intelligence, but seem like such simple things that we ought to be able to do. And then there's the masking and compliance of trying to win or get approval. And I will leave with this excerpt from a study from Amen and Smith on a case study of coach and therapists working together to support a client, that sort of articulated how these two practitioners work together to the benefit of their client. With the client's permission, her coach and psychiatrist spoke several times during the 8 weeks of coaching. Coaching is generally limited to a specific period of time, specific goal or set of goals, providing each with a broader understanding of her needs, choices, challenges, and goals, and thus optimizing support for the client. For example, the psychiatrist was able to provide the coach with a clinical perspective on the client's ADHD, the reasons for the chosen medication and doses, and how they are affecting her functioning. The psychiatrist who had worked with the client for a number of months prior also emphasized concerns she thought were essential to address behaviorally to support overall ADHD management. And the coach shared with the psychiatrist details of the client's coaching plan and progress, giving the psychiatrist a closer view of the client's challenges and successes. The coach also shared observations based on weekly coaching sessions and more frequent communication with the client about possible anxiety symptoms. This enabled the psychiatrist to modify the client's medication regimen to more effectively treat her. I'll interject here that often coaches will provide support at the point of performance. So having somebody that the client can text when they're trying to get out the door to work in the morning, reminding clients, hey, did you still want to try to get to bed by this time? Not directive, but creating that reminder and that sort of opportunity to co-regulate and externalize support. The psychiatrist also asked the coach to provide a letter detailing the client's functional improvements, tracking improvements, which she shared with the client and then forwarded to the university committee, considering whether the client could resume her program. And that is it. Finn, if folks have questions, if we have time, I'm happy to answer them. If we don't have time, you are welcome to email me questions, and I will put my email in the chat. Yeah, thank you all for being such a polite audience.
Dylan, thank you so much for being here. It is always really, really good to hear you talk. I was wondering, are you doing any groups for providers? So for me, as a therapist, I wasn't really sure what to expect out of coaching. And what I had seen was a lot of stuff on social media where it was like you were describing, like, do it like me or use this planner and you'll be better. And I didn't really understand it until I joined one of your groups, and it was so incredibly impactful and helpful for me. Do you have anything like that for providers who want to experience it?
I haven't, but I would be very open to.
Okay. And in the comments, we had quite a few questions and just thoughts popping up as you were talking. There were themes of how do you parse out ADHD and autism symptoms, and how do you parse out ADHD and CPTSD symptoms? And there was a note that often kids after being abused are diagnosed with ADHD, but not PTSD.
Yeah, absolutely. In terms of parsing out those aspects, to be entirely honest, that's not my job. I don't have the training for that. I did listen to a particularly wonderful expert webinar from ADHD Attitude Magazine on ADHD and treatment-resistant depression, in which the expert mentioned a new tool for psychiatrists and psychologists called Clinicom that does differential diagnosis. I have a colleague who's a psychiatrist who's going to let me take it for a spin. I'm very excited to try it out. Report back, but apparently it's spectacular in distinguishing diagnoses. How I work with that, though, is that figuring out correlation and causation. right? If it's the same symptom of, say, struggling with novelty, ADHDers, if we're looking very broad strokes, ADHDers love novelty, right? Many folks with autism do not do well with novelty. It's not their favorite thing in the world. Anxiety, CPTSD, novelty cannot be great as well. Structure. ADHDers can be very, very emotionally resistant to structure and also crave it. Folks with autism can love structure. There's a parallel there of like, we both, ADHD and autism, love our structure that works for us, right? I like to think of like a crutch as a support structure, but if I just duct tape it to my body and try to like go about my day, it's not going to be very supportive. I have to use the structure in the right way. Similarly with trauma, a key aspect of trauma-informed practice, as folks know, is trust, collaboration, and empowerment. So, all of those things, there's a huge overlap. If I look at in our strategies, what actually creates improvement, that can help us identify what it's coming from. So how does it respond in context? Is it, in distinguishing between, trauma and ADHD, if the trauma doesn't come from very, very, very early, development, if it's a later in life trauma, we can look at, is this something that's been consistent through the course of the lifespan? So there are ways to sort of suss out where it might be in terms, but I would use that as a coach in terms of strategy, in terms of identity and integration. That is definitely a place where I would encourage the client to bring this to the therapist to figure out. And I hope that didn't sound like passing the buck.
I think that was helpful clarity. Are there additional questions before we move into the consult portion of our meeting?
I have a question. I didn't know how to raise my hand. I couldn't figure it out. Hi, Dylan. You're awesome. Thanks for coming back. I got to see your presentation last year too. And I have referred clients to your website because I know you and I've seen you. But my question is, do you have a referral list for us therapists who have clients who ask for ADHD coaches? Because I will send everybody to you, but like if there's another list that I could also provide so you're not overwhelmed.
I appreciate that so much. I appreciate the referrals, and I appreciate the awareness of overwhelm. I am absolutely at a space where I should probably start some groups, and there's that just executive function aspect of how does one schedule with groups, figuring that out. If anybody has any tips, please send them my way. On the NeuroQueer website, if you look at Meet the Coaches, we keep a directory of coaches who are available, who are neurodivergent, competent, who are queer friendly. I'm actually putting together a list of not necessarily queer, not queer specific. Not that there's anything wrong with not being queer. Coaches who folks can, at least some. I can't say reliably, but that there is that at least like there's a certain confidence or trust in a network of referrals. There's so much need right now. There's so much need for support, and it can be really overwhelming for folks finding a provider. So yeah. Sorry, my brain just went in too many possibilities.
That responded to my question because I didn't realize you were still with other people. I feel like I have found your website that was like just you. So what you just said, I'm looking at like 4 or 5 different coaches on your neuroqueer.org, and that's exactly what I will continue.
Perfect. Great. Thank you so much.
I'm
so glad.
Thank you.
Yeah.
And we have Another question in the chat. So it says, thank you so much for this presentation. Do you know of any additional presentations that have an Indigenous perspective on neurodiversity?
Ooh, what a great question. What a great question. Yeah, I've currently been diving into coyote mythology in Indigenous cultures, and how often that seems to be very ADHD coded. That is a very underdeveloped area. Let me dig into my archives. If you send me an email about that, I may have some resources for that.
Awesome.